ಬೆಂಗಳೂರು ನ್ಯೂಸ್ ನೆಟ್ವರ್ಕ್.
ವಾಣಿಜ್ಯ ಹಾಗೂ ಇತರ ಸುದ್ದಿಗಳನ್ನು ಅಂತರ್ಜಾಲದಲ್ಲಿ ಬಿತ್ತರಿಸುವ ಪ್ರಪ್ರಥಮ ಇಂಟರ್ನೆಟ್ ಚಾನೆಲ್
ಬೆಂಗಳೂರು ನ್ಯೂಸ್ ನೆಟ್ವರ್ಕ್.
ಪ್ರಪಂಚದಾದ್ಯಂತ ಸುದ್ದಿ ಬಿತ್ತರಿಸುವ ಮಾಧ್ಯಮ
ಬೆಂಗಳೂರು ನ್ಯೂಸ್ ನೆಟ್ವರ್ಕ್. ಲಾಗ್ ಆನ್ ಆಗಿ
www.bangalore-newsnetwork.com
www.bangalore-newsnetwork.com.
IIHMR Bangalore. Now IIHMR Bangalore is the south campus of Group of Institute of IIHMR Society, Jaipur. Now this institute has been set up in 2004 with a very specific objective, and the objective that, as our mission says, that we are here, the institute is working to improve the standard of health of the people through better management care and related program, basically by three activities: by teaching, training, research and consultancy through national, international networking. And this conference is one of the such activity which we organize every year. So this is in the third conference in a series of annual conference. And the objective of the conference is bring together, provide a platform to all stakeholders working in healthcare industry, including government, NGO and hospital, and the young students. So this is the platform when we give them and they come together. So the diverse mind, they work together and they discuss about their research findings and they think together for developing new interventions, providing evidence-based information for developing health program and policy in this country.
This conference is focusing on trends and approaches in healthcare in the context of 21st century. The whole idea is to create and generate knowledge about what are the challenges and what are the solutions, what innovations are required as of now to deal with the challenges of 21st century. We in 21st century face several challenges. One of the most important challenges that we are facing is because of the changing disease burden. Up till now we had diseases like cholera, typhoid, all those sorts of things. But now we have more chronic diseases or non-communicable diseases like cancer, diabetes, cardiovascular disease or heart diseases. So in coming time, this is 2014, and by 2020 almost 70-75% of the disease burden will be because of these diseases, and we need to be ready for that, and we need to really create awareness among policymakers. We need to do research in this area, how new strategies can be developed for dealing with this disease burden due to new types of diseases which have just started appearing in India. The other important thing that is happening now in 21st century we anticipate is, the increasing population, particularly aging population. Now their healthcare needs are very different, and we have to prepare ourselves for meeting the challenges of healthcare needs of old people. Now this conference, what we are doing, we have invited experts to speak on these issues. What we are doing also is giving opportunity to our management graduates to present their own studies in the context of these challenges. So not only it's going to help them to create their knowledge, but also their confidence, their ability, and more importantly, as I said earlier, employability. Today we have a problem of youth which are not employable. That's a big problem that is coming up. I don't know what is the reason for this. Is the quality of education or lack of jobs? But as an employer, I feel they are not employable. So we need to really develop this young youth into a skillful, knowledgeable group of people, because they are going to be the largest and will be, there for another 40, 50 years, and the whole development of the nation will depend on their own skill sets, their competence, their motivation, their ability to perform. I think that we are going to handle in this particular conference. Dr. Dhiren Kumar, who is the director of this institute, is leading this particular conference. IIHMR Bangalore is trying to create a momentum for improving health of the people through improved management of the healthcare organizations and hospitals in southern India. We have made a beginning. Hope we will succeed.
You should be in healthcare, in life, and to deliver the service, because we believed there was a need here for patients to have access to good quality doctors. And then now it's Africa and India. So I think my lesson from that journey was that one needs to use the same domain, the same knowledge that you get in working with the Western world, but use it for social good. And we're like, what are we going to do with your money? When we know what we'll do with your money, we should come to you. But I think in healthcare, perhaps unlike in other true businesses, it's not all about the money. And so I'm maybe going to say something that's contrary. I'm an entrepreneur, I'm also a doc, but it's not all about the money.